Spinach is an extremely nutritious vegetable loaded with high amounts of carotenoids, vitamin C, vitamin K, folic acid, iron, and calcium. Eating spinach regularly may help promote eye health, lower inflammation in your body, prevent many types of cancer, and keep your blood pressure in a healthy range. But it's equally important to know about certain health problems in which you might want to avoid spinach. Let's learn about them and see how you can eat spinach safely if you have those health conditions. Let's begin with number 1 on our list: kidney stones. A half cup of cooked spinach may contain as much as 755 milligrams of oxalates and 120 to 130 milligrams of calcium. High amounts of both oxalates and calcium in the urine can increase the risk of developing calcium oxalate stones, which are arguably the most common kinds of kidney stones. But there's a twist. In the intestines, oxalates in spinach can actually bind with calcium present in the food. When that happens, this complex forms an insoluble compound called calcium oxalate, which is excreted in the stools rather than being absorbed into the bloodstream. And that seems to be the trick to avoid kidney stones while eating spinach or other oxalate-rich foods. Get more calcium from plant-based milk or dairy milk if it suits you when you're eating oxalate-rich foods. But people with a history of kidney stones or those with pre-existing CKD or kidney failure should still be careful about eating spinach. Avoid spinach altogether or eat minimal amounts of spinach if your healthcare expert allows you to. There are other ways to reduce oxalate levels in spinach and lower your risk of developing kidney stones. Stay with us till the end to find out. Number 2. Gut disease. If you have any gut conditions such as leaky gut or SIBO, intestinal dysbiosis, in which the number of bad bacteria in your intestines is more than the good ones, or inflammation, you may need to rethink your spinach intake. But why? Certain good gut bacteria can actually feed on oxalates, preventing them from absorbing into the bloodstream. On the other hand, if you often take antibiotics, don't take enough prebiotics, drink too much, or consume too many sugary foods and drinks, the balance between good and bad bacteria gets seriously disturbed. When that happens, you might start noticing common gut issues such as constipation, gas, bloating, and diarrhea. And that's when more oxalates might be absorbed into your bloodstream than the amount leaving your gut with stools. Plus, when you have IBS or IBD, you might have a higher risk of developing kidney stones. Because the inflammation with IBS conditions can make it difficult for your body to properly absorb certain compounds. This results in malabsorption, which can sometimes result in kidney stone formation. Studies show that the rate of oxalate absorption rises from the normal level of 1 to 2% to as high as 40 to 50% in people with leaky gut, intestinal dysbiosis, or inflammation, increasing the risk of developing kidney stones. So, if you are more prone to kidney stones or have other digestive health issues, you might want to avoid spinach. Number 3. Gout or joint pain. Gout is actually a form of inflammatory arthritis that occurs when urea crystals build up in your joints. This causes inflammation and intense pain in your joints, also known as gout attacks or gout flare-ups. Urea or urate crystals usually form when you have high levels of uric acid in your blood. Your body makes uric acid as a byproduct when it breaks down old or dead cells, or when you eat foods that are high in purines, especially organ meats, fish, legumes, and some leafy greens like spinach. Cooked spinach contains about 30 milligrams of purines per 100 grams. Experts say that gout patients should not take more than 120 milligrams of purines per day. Although the number of purines in spinach is under that limit, it's still important to consider it because you might already be getting purines from other daily foods. So, if you want to prevent gout flare-ups or lower uric acid levels in your body, it's best to avoid spinach or minimize its intake. Number 4. Thyroid problems. Hyperthyroidism is a condition in which there's too much thyroid hormone in your body. When you have hyperthyroidism, your thyroid gland becomes overactive or enlarged, producing more thyroid hormone. Normally, thyroid hormones help your body produce energy, maintain the body's temperature, control growth and development, and even the function of your heart, brain, and gut. But when your thyroid gland overproduces these hormones, it speeds up the body's metabolism. That might result in weight loss, hand tremors, anxiety, sweating, eye problems, irregular heartbeats, and many others. Cruciferous vegetables like broccoli, spinach, and cauliflower are rich in goitrogens. Goitrogens can interfere with the way how thyroid gland absorbs iodine. This effect may be pronounced in people with hypothyroidism, goiter, or those with iodine deficiency. On the other hand, spinach may not be that bad for people with hyperthyroidism. In fact, calcium present in spinach may actually help people with hyperthyroidism, as they are more prone to develop osteoporosis or other bone disorders due to overactive thyroid. However, they must ensure that they get more calcium from their diet or supplements because the calcium amount in spinach might not be enough. Number 5. Chronic kidney disease. In chronic kidney disease, your kidneys might not be able to filter wastes and excess fluids from your blood as efficiently as they did before. This can cause levels of fluids, minerals, electrolytes, and wastes to build up in your body. People with kidney disease are usually at risk for high potassium levels in their blood, mainly because their kidneys are unable to remove the extra potassium in their blood. The extra potassium can be very dangerous as it affects the way your heart's muscles work. Having high potassium levels can cause your heart to beat irregularly, causing arrhythmias and potentially increasing the risk of having a heart attack. Spinach, like many other leafy green vegetables, is high in potassium. 1 cup of cooked or boiled spinach contains at least 839 milligrams of potassium, while people with kidney disease usually need to keep their potassium intake below 2,000 milligrams per day. This means you'll be getting almost half of the amount with just one meal, and it could easily increase your potassium levels even if you ate other low-potassium foods during the rest of the day. To lower potassium levels in the spinach, soak it in cold water for at least 2 hours, then boil it for at least 10 to 15 minutes, and then discard the water. You can boil it again in fresh water for another 5 to 10 minutes to leach out even more potassium. This way, you can lower its potassium content to as much as 60%, making it much safer to eat. Number 6. Blood clotting disorders. Certain genetic conditions, heart disease, diabetes, kidney disease, and high inflammation levels in the body in general can increase the risk of developing unwanted blood clots in your blood vessels. However, too much clotting can increase your risk of getting a heart attack or a stroke, and may also damage your other vital organs like kidneys, lungs, and liver. Blood clotting disorders are often treated with anticoagulants or blood thinners. These medications tend to decrease your blood's ability to clot. Spinach, like some other leafy greens, like Brussels sprouts and broccoli, is rich in vitamin K. This vitamin K can interact with blood thinners like warfarin or aspirin. Your healthcare expert might even ask you to stop eating spinach if you're taking warfarin. If not, ask them about how much spinach can you eat daily while taking your medications. Number 7. Hypocalcemia or low calcium levels. Besides lowering the risk of calcium oxalate stones, there is another reason to drink milk or eat other calcium-rich foods with spinach. As mentioned earlier, oxalates in spinach can contribute to the formation of calcium oxalate stones. This means that the more oxalates in your gut, the more they will bind with the calcium in your diet, reducing overall calcium availability for your bones and teeth. Besides keeping your bones strong, calcium helps your nerves work and your muscles contract. But when your body is not getting enough calcium from your diet to maintain those functions, it starts leaching out calcium from your bones, which can result in weakened bones. Moreover, you may notice symptoms like muscle cramps, especially in your back and legs, in addition to dry, scaly skin, brittle nails, and in severe cases, abnormal heartbeats. So, when you have calcium deficiency, you must consider increasing your vitamin D and calcium intake, as well as limiting oxalate-rich foods like spinach and other leafy greens. Here are some frequently asked questions about spinach that you might already be looking for. Number 1. How to reduce oxalates in spinach. Oxalates are water-soluble substances, so they can be easily lessened by blanching, boiling, or steaming with water, and then discarding it. Eating boiled spinach may lower the concentration of oxalates by as much as 67%. Number 2. Is there a way to reduce purines in your food? You have to choose low purine options such as low-fat and plant-based dairy products. You can also eat fresh fruits with low sugar, nuts, peanut butter, and grains. Number 3. Is spinach better raw or cooked? For oxalates, cooked spinach is always a better choice as cooking breaks down oxalates and lowers their levels. However, in the case of potassium, cooked spinach contains relatively higher levels as compared to raw spinach. The best approach if you want to avoid both potassium and oxalates is by soaking and boiling spinach and then cooking it. There are other oxalate-rich foods that kidney patients should avoid. Have a look at them.